Hey everybody, it's time for a COVID-19 vaccine update. I last talked about this vaccine back on March 195th or sometime in mid-September using the old Julian calendar. In that video, I talked about how it's okay to be skeptical of a vaccine if it was rushed through by Donald Trump prior to the election, and how the United States has screwed up in the past rushing vaccines against the warning of doctors and other scientists. But ultimately, I suggested that we all relax, wait until the vaccine comes out, and then see what the experts have to say. Well, Election Day came and went without Trump's promised vaccine, and thank science for that, because the worst possible scenario would have been Trump going on TV, telling people that he personally developed a vaccine the same way Homer Simpson invented the flaming Homer by mixing random things he found around the house, including the secret ingredient, Krusty brand non-narcotic children's cough syrup. And then everyone would try to reach out to Dr. Fauci for reassurance, only to find out that he had died in a tragic speedboating accident the day prior. And so we would all just shrug and then line up to get injected with whatever. But happily, Trump's lie about having a vaccine ready by Election Day turned out to be arbitrary, or in other words, a lie. And a month later, things are actually looking really good. I mean, they're looking good in part because Trump lost the election, but also because there are two COVID-19 vaccines that are set up to possibly be approved by the FDA this week for Pfizer's and next week for Moderna's. In light of that, I wanted to update my previous video with the news that as of right now, I personally am excited about these vaccines and I will absolutely be getting one as soon as I can. I won't be first in line by a long shot. The first vaccines are going to go to frontline healthcare workers, people in retirement homes, and others who are most at risk of contracting this virus. Then it's going to go to essential workers, other older people, people with other comorbidities, people in prison, people without houses. And then eventually it's going to trickle down to everyone else where I am. And, you know, it's fine. I'm absolutely disgusted by the idea of interacting with other human beings right now, so I am happy to continue sheltering in place until the vaccine is available to me. I'm expecting it to be available to me, hopefully by next spring, since there are so many people in line ahead of me. And if the rollout goes well, then, oh my God, we might actually have a normal summer, and it's very exciting. Note that this is still an extremely fast timeline to develop and implement a vaccine. So you might be a little worried about that, but it should not be a concern to you. And here's a quick overview of why. First of all, the Moderna vaccine has actually been around since January, before China even admitted that COVID-19 could be passed from human to human. Scientists were able to whip it up in a weekend, thanks in large part to previous work done during the, or after the 2003 SARS pandemic. SARS was also a coronavirus, and through testing, researchers learned that the key to stopping a coronavirus is to target the spiky protein. They do this by using messenger RNA, mRNA, which is a newish way to make a vaccine. You probably think of a vaccine as being a weak or dead version of a virus that you get injected into you in order to train your body how to attack that virus without giving you the full whammy of the virus. That's not what happens with mRNA. Instead, the mRNA just tells your cells to look out for that very specific little spike on the coronavirus. And your body then makes the antibodies without ever actually seeing the whole virus. The mRNA never interacts with the cell nucleus, so it doesn't get anywhere near your DNA. You can think of it like a set of instructions that come with your IKEA desk. Once the desk is built, you can throw the instructions away, but you can keep the desk. Scientists have known this type of vaccine is more or less safe for years now. It's certainly safer than contracting COVID-19, and there's not likely to be any major side effects. What they don't know for sure, and what the end trials are all about, is figuring out exactly how effective it is. And what they won't know for months or maybe years down the line is how long it remains effective. Like, your cells built the IKEA desk, but how long is that desk really going to last? Is it made of real wood, or is it made of particle board? It's possible that in a few years, your cells are going to need to get another set of instructions to make a new desk. So on the safety angle, check. We know it's safe. Both vaccines up for approval in the United States are mRNA vaccines. They are definitely safe. What about efficacy? Well, that's also good news. The Moderna vaccine was found to be 95% effective. And if you're curious about exactly what that means, I definitely recommend you check out this easy-to-read post by Mary Brock, who is Skepchick's resident antibody expert. The short answer is that it means that 95 people in the Moderna trial got COVID-19, of whom only 5 had received the actual vaccine instead of the placebo. 90 is 94.7% of 95, and therefore 95% effective. And 95% is a really fantastic efficacy rate. The annual influenza vaccine, which could save thousands of lives each year if absolutely every person got it, is only about 50% effective on average. 95% is more on track with the MMR vaccine, which after 2 doses is 97% effective against measles. As I say, we don't know how long the immunity will last from these vaccines, but we do know that if everyone gets vaccinated, we can get back to a normal life. Unfortunately, we already know that not everyone will get vaccinated. Fearmongers have kept people from getting the extremely safe and effective MMR vaccine. And Fox News has already prevented people from wearing masks and staying home, like the simplest of things you can do to stay safe. So just because something is safe and almost guaranteed to work, it doesn't mean that Americans are going to do it, thanks to our hyper-politicization of even the most obvious facts. But despite that, I do urge you to please continue to do your part, because it does help. Stay home, wear a mask if you have to go out, and when the vaccine becomes available, please get it. Not everyone is doing the right thing, but the more people who do the right thing, the fewer people die. Here in the San Francisco Bay Area, our sheltering in place has had a real noticeable impact on the health of our residents, even though not everybody is doing the right thing here. As the chair of UCSF's Department of Medicine points out on Twitter, if the U.S. had SF's per capita mortality rate, the nation would have had 60,000 deaths, not 276,000. That's 216,000 people who would still be alive today if the rest of the United States was just as imperfect as San Francisco. So yes, herd immunity would be great. A normal summer would be great. But even if we can't reach that, every little bit helps. We can still protect a lot of lives. So please keep up the good work. Keep staying inside. Keep wearing your masks when you go outside. And absolutely get the vaccine when it becomes available to you.